For this video, I'm going to do a male indwelling Foley catheter. So the very first thing I'm going to do is check the patient record. I'm going to see if the physician still has this on order. And let's see here. Looks like he does, so I'm going to go ahead and gather my supplies and go meet my patient. Knock, knock. Hi there, Jose. My name's Tabitha Olson. I'm going to be your nurse today, and I need to put in an indwelling catheter, so can I get your date of birth? And he tells me his date of birth is 9/16/95, and his name on his badge matches Jose, what he had said. So first I'm going to talk with him, and I'm going to let him know that what's going to happen with the procedure, and if he's had this done before, which he hasn't, so I'm going to tell him we're just going to take a tube, and it goes into your urethra and into your bladder, and then we inflate a balloon in there to kind of hold it in place, and then we just kind of have a drainage tube to drain that urine out of your bladder. If there's any family in here, I'm going to ask them to leave. I'm going to provide for some privacy for him. And then I'm going to go ahead and raise his bed to a working height so I don't hurt my back. And then I'm going to wash my hands, apply my gloves, I'm going to lower the bed rail close to me. I'm going to lay him down flat. And then, Jose, I'm going to uncover you here. So I got the covers off. I'm going to have him lift up the gown, cover him up. It's a little chilly in here, so we're going to give you that so you feel a little warm. I'm going to have him spread his legs out if he's able to. If he's not, I'm going to ask my assistant for help. And then once I have him spread open, I have a pad here. I'm going to get underneath. Now, Jose, can you lift up for me? And he can't, so I'm going to ask for some help. Can you please help me? I'm going to get a little help and lift him up. Now we're going to make sure his legs are spread open and that he's positioned correctly. Alright, I'm going to get my warm soapy water. And I'm going to, Jose, I'm going to clean you now. I'm going to start in the middle here, and we're going to make sure we get this nice and clean. Going around a few times. Switching my cloth as I wipe. I'm going to make sure to go down the sides. And if he's circumcised, I'm going to go ahead and pull back the foreskin and make sure I get that all cleaned up as well. And we're going to get done there, so I'm going to get rid of my water. I'm going to take my gloves off, and I'm going to wash my hands. And then I'm going to set up my workstation. So I have the biohazard bag here. I don't think I need that though. I'm going to open my kit. And I'm going to be careful with this when I open it. I'm going to my trash can close. Only touch the very outside edge of this kit here so that I don't contaminate anything. I'm going to remove my sterile gloves. And when I do my sterile gloves, I'm going to grab the inside of the first glove and put them on, making sure not to touch the outside. When I get my second glove, I'm going to go up inside the cuff, making sure not to touch the inside. So I have my sterile gloves on. I'm going to go ahead and make my sterile surface here. So shiny side down. And I'm going to kind of put this up on his thighs a little bit just to protect that and make a bigger working area. And then I have this fenestrated drape. I'm going to put shiny side down, Make sure I position it correctly. I have this nice open sterile field. I'm going to make sure not to cross it now. Open up my packages here. I have my wipes. I have my lubricant. And at the beginning of this procedure, if there was any type of need for a numbing gel, I would have done that and let that set before I started the procedure so that he was comfortable. So my label there. And then I'm going to take this and I'm going to attach it and make sure that my balloon inflates and deflates properly. Looks good. So I'm going to remove that, deflate that balloon, and then I'm going to leave that attached here. And I'm going to put my catheter in the lubricant and leave that set there while I work. Let's see if we can, here we go. Okay. So Jose, the next thing I'm going to do is you're going to feel me touch you. I need to clean you up a little bit here. I'm going to take my wipes. I'm going to start in the center, swirl around, get rid of that. I'm going to do it again, start in the center, swirl around, a little bit further this time, and then I'm going to do the same thing. I'm going to go a little bit further this time. I'm going to get a hold of this catheter, kind of twist it up here so I have a good hold. Okay, Jose, I'm going to insert this. Go ahead and take a deep breath for me. I'm going to go ahead and put this in about 7 to 9 inches. If there's resistance, we can twirl it a little bit to try to get it to move past the prostate. Once it's in, and I see urine starting to flow, I'm going to go another inch or 2 just to make sure we're inside the bladder. And then I'm going to hold that with my other hand while I inflate the balloon. And I'm going to pay attention to how many cc's I put in there. Looks like we got all 10, so I'm going to detach that. And then I'm going to tape this onto his upper thigh. Let's grab my tape here. See if it's in the pocket here. Got some tape, so I'm going to get a hold of that. Alright. I'm going to make sure that that's securely in place so that it doesn't tug and fall out and doesn't cause any problems. And then I'm going to clean up my work area here. So I'm going to discard of all of this. And I have my specimen for later. My whole sterile field will just get cleaned up and in the trash can. And then I'm going to clean him up. So I'm going to get some warm soapy water. I'm going to wash up really well. Make sure we get all that betadine off. I'm going to start in the middle, clean around the outside. I'm going to move to the outside, clean it up really well. Make sure that everything we got is cleaned up. I'm going to pat him dry a little bit here. Then I'm going to ask him, you know, how that went, how he's feeling. Jose, are you doing okay? He tells me it is, so looks like we're good to go. We got it draining. There's urine coming out. So I'm going to wash my hands, take my gloves off, remove my pads, reposition him correctly, get him back comfortable, recover him up here. And then I'm going to, let's get you covered up here, Jose. Just back up here. Would you like your head up? Yes, so I'm going to put his head up so he's comfortable. I'm going to raise the rails, and I'm going to lower the bed. And then once that's taken care of, I'm going to step out and I'm going to make sure that I go to his chart and document. I'm going to document the date, the time, the procedure was done, how the patient tolerated it, and anything else you need to document.